This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. June is Prostate Cancer Awareness Month. Prostate cancer is the second most commonly diagnosed cancer among men. It is ranked as the sixth leading cause of male cancer deaths.
That's why there's a lot of emphasis now on finding out prostate cancer or detecting prostate cancer, because once we diagnose prostate cancer, if we diagnose it early, we can cure patients and we can save them from all the complications and sometimes even from death. The men, of course, only men have prostates, and the men who are at risk for prostate cancers are those who are 55 years old and above.
Some of the symptoms of this cancer include trouble in urinating, presence of blood in the urine and in the semen, and discomfort in the pelvic area.
Unfortunately, for prostate cancer, there are no early symptoms. When you get symptoms, more often than not, it's in the advanced stages of the disease. And it is only detected usually when you have an abnormal feeling prostate on a rectal examination or when your PSA is elevated. And that is a lot of times that is usually discovered during routine examinations, routine checkups, or sometimes during executive checkups.
What are the causes of prostate cancer? What are the complications of this disease? Are there tests that can detect prostate cancer? All these and more tonight on MedTalk. Joining us tonight is Dr. Aris Roque, urologist and chairman of the Prostate Health Committee of the Philippine Urological Association. Also with us is Dr. Jason Letran, uro-oncologist and vice president of the Philippine Society of Uro-Oncologists. Good evening, doctors. Welcome to the show.
Good evening, Angel.
As mentioned in the VTR, it's Cancer Awareness Month. June is Cancer Awareness Month. It's also the month when we celebrate Father's Day.
Father's Day.
And we want the men in our life happy, healthy, strong, free of any health issues or problems. But as they reach seniority, there are some functions of the body that aren't functioning as well when they were in their younger years. And among men, one of these organs is the prostate. So what exactly is the function of the prostate as an organ of the body?
Okay.
Dr.
Okay, the prostate is only found in men, as mentioned by Dr. Serrano in the DTR. And it usually, the function would be, it secretes seminal vesicle that would help nourish the transport of the sperm. And that's the main function of the prostate.
And the prostate also includes a substance that would liquefy the ejaculate so that the spermatozoa would be able to better penetrate and pass through the vaginal vault of the female.
So this is used in reproductive
Yes,
health.
that's important in the reproduction.
Very good. So please describe to us or help us understand what is a healthy prostate. Healthy prostate gland.
A healthy prostate gland is a gland that do not have any abnormality in the visceral rectal examination, with a PSA of below 4, although the lower the better, because there's such a thing as age-specific level. So let's say for an elderly individual with a PSA of 2, that can be normal, but for younger individual, a PSA of 2.5 may already be an abnormality or may indicate an underlying prostate cancer. Now, furthermore, in the rectal examination, there should not be a feeling of swelling of the prostate, which may be an indication of an underlying infection or prostatitis.
Dr. Roque?
Yes. Also, we have to be particular with the size of the prostate, because the size of the prostate could also mean that there will be an obstruction of the urine flow. And this is very prevalent among elderly male patients. And this is what you call, labeled as benign prostatic enlargement or benign prostatic hyperplasia.
In relation to reproductive health, what is a healthy prostate gland like?
Usually, a prostate with the size of 10 to 15 grams, as mentioned in the literature. The thing is, among Filipinos, it's a little bit smaller. And whenever there's during the digital rectal examination, there should be no pain elicited during and there will be no discharge during the examination.
How about in relation to urinary health?
Well, if you look at the anatomy of the prostate, it is located below the urinary bladder. It encircles the urethra, or the passageway of the urine from the bladder to the genitalia. So if there's enlargement of the prostate brought about by the aging process, what happens is that it may impinge upon the passageway. And sometimes that is a so-called the anatomic component. But there's also such a thing as dynamic component, meaning it is a tone of the prostate. Sometimes prostate gland may not be that large, but they have a tone that is constrictive. So it also tends to obstruct the passageway. And sometimes because of the chronic obstruction, it can cause some response of the urinary bladder, causing it to become more hyperactive, so that these all would lead to symptoms called lower urinary tract symptoms. Okay. So it is characterized by a decrease in the urinary flow, sometimes frequency, inability to delay the urine, or we call it urgency, sometimes feeling of incomplete bladder emptying. All of these are symptoms of prostatic enlargement. Actually, these symptoms are usually associated with benign prostatic enlargement, not in an early symptom of prostate cancer. So as Dr. Serrano had mentioned in the VTR, early prostate cancer is usually asymptomatic. So these symptoms are not symptoms of prostate cancer, but usually symptoms of enlargement of the prostate, which usually could go hand in hand with prostate cancer.
So we mentioned already what a healthy prostate gland is like, and you also mentioned, doctor, that there are some signs and symptoms that go with noticing an unhealthy, so to speak, prostate gland. How about other signs and symptoms like an inflammation maybe, or maybe a non-cancerous gland that is located in the area?
Yeah, usually the prostate gland is also affected by infection, and this is what you call as prostatitis. This could be acute or chronic prostatitis. This is usually affects men in their reproductive age group, usually with multiple, they said that with multiple partners, you could contract sexually transmitted infection, which would eventually infect the prostate.
Is this cause for alarm if there's inflammation, and what does one feel when there's an inflammation in the prostate gland?
Actually, the patient would really go to you because of prostatitis. 90% of consultation regarding genitalia is about prostatitis. And they would describe it as painful urination, or there's a tenderness between the scrotal area and the anus. Mm-hmm. So that's for prostatitis.
But does prostatitis lead to cancer?
Some would say that chronic infection would lead to a form of cancer, but in this particular disease entity, it rarely happens.
Mm-hmm. So if it rarely happens, then early detection, as we always say, is key. Mm-hmm. And when yes, one feels discomfort already in urinating, or when one notices, is there a change in color when one is inflamed, when the prostate is inflamed, when one urinates? In
the urination, yes. The patients because there are two types of prostatitis, the acute prostatitis and the chronic prostatitis. What Dr. Roque mentioned earlier were symptoms of acute prostatitis. Those were the problems that would lead the patient to really sought consultation even at the middle of the night, because they have severe voiding difficulty, not to mention fever and chills. Now, those things can happen in acute prostatitis. However, the other type of prostatitis is a chronic type. This is usually brought about by incompletely cured acute prostatitis, or these are the patients that would manifest with recurrent urinary tract infection. And in the urinalysis, they always come up with pus cells present in the urine. And these are sometimes associated with some form of pelvic pains, although mostly quite a lot of patients are asymptomatic as well. Now, you mentioned about any changes in the color of the urine. Usually
Yes.
none. No, there's no change in the color of the urine.
And how does one distinguish between prostatitis and the UTI, like an ordinary UTI? Is there a difference?
Actually, UTI is the umbrella classification, and one of which would be prostatitis, because when you say itis, there's inflammation of that particular organ, prostatitis. There. You cannot actually distinguish because there are a lot of organs involved in urinary tract infection. It could be the kidney, pyelonephritis, bladder, cystitis, and prostate would be prostatitis.
So doctors will talk about the non-cancer enlargement and prostate cancer. But before that, we have a question from our Twitter page. From Joe, doctors. I'm 28 years old. I want to know how I can prevent having prostate cancer. 28.
Okay, 28 years old, the exact cause of prostate cancer is still not known, no? But we have to know what are the predisposing factors. First would be the unchangeable factors. This includes your race and the family history. Generally, prostate cancer would be less common among Asians, more common among African Americans and Caucasian population.
Why is it less common among Asians?
Well, they can always say it's genetic, but I think partly it may be the diet as well, no? Because the Caucasians may have a diet higher in fats, and the Asians supposedly have diets lower in fat. However, there are some studies that have shown that the Japanese migrants to Hawaii, when compared to their age-matched controls in native Japan, showed a higher incidence of prostate cancer that approaches almost that of the American population. So diet most probably plays a role, and diet is one of the modifiable risk factor of prostate cancer. And of course, family history as well is one of the risk factor of prostate
It's
cancer.
an uncontrollable risk
Those
factor.
are uncontrollable,
risk
yes.
factors. Another question, doctors, from Twitter, from RDL. At what age should I consider consulting a doctor about prostate cancer?
Usually, the age would be around 40 years old and above, because this age group would have already started the incidence of prostate cancer. Usually 20% of the time, one autopsy, a series of autopsy done in the US mentioned that within the age group of 40 to 45, there's already 20% indolent form of prostate cancer, meaning they already have it, but it didn't cause their death, but they already have it.
Why at that age? Is there any particular explanation for 40 and above?
Well, cancers are, as we have discussed a little earlier in our informal discussion.
Yes, doctor.
Thus, everyone has the predisposition to form cancers. Yes, no, if one lives long enough and would be exposed to a lot of carcinogens and factors that would change the composition of the cells, then they can mutate into cancer cells. So as one ages, there's higher tendency to be exposed to those risk factors that may predispose them to develop cancers. There is just one controversy that I would like to raise. This is with regards to the screening, because very often we receive comments from patients challenging the screening for prostate cancer, because they say in American population, routine screening with PSA for prostate cancer is no longer that encouraged. However, you have to understand that in America, the way they treat prostate cancer, they were very aggressive in treating cancers as early as the 1990s. So we were actually 10 to 15 years behind the American population. So the patients that we are seeing right now are still patients with aggressive type of prostate cancer and are still worth screening.
So still worth a screening, still worth the other tests that can determine
Yes.
if one's prostate is enlarged or if one has the cancer cells already. But before that, doctor, we will take a short break. MedTalk will be right back.
Did you know that women have prostate glands too? It is called Skene's glands, or the paraurethral glands, located a few centimeters into the vagina or in the G-spot. Skene's glands can get blocked, infected, enlarged, or present with cysts, but these conditions are not very common.
We're back here on MedTalk, still discussing prostate health. Doctors, before the break, we were talking about the controversy that has been raised because of the tests done. How about here in the Philippines? What are the tests that are administered, or what are the tests that one can opt to have when one wants to check for the health of their prostate?
Usually, patients would come in because they would want to know if they have cancer or not. The thrust would be to do a digital rectal examination that's examining of the prostate via anal pathway. The second would be an ultrasound, transrectal ultrasound, and the PSA, the one you're referring, the prostate-specific antigen. So these three combined would increase the sensitivity and specificity of the diagnostic exam.
And when one does choose to have either, does one, how is it done? Or, sometimes men might be a little bit, no, I wouldn't use the word afraid, no? Maybe uncomfortable, maybe, to undergo a test like this. But what's the assurance that it works? What's the assurance that they're in good hands?
The PSA, to start with, is just a blood extraction. And the digital rectal examination usually are done by fellows of the Philippine Urological Association, and they do it every day. And the ultrasound is less invasive.
Okay.
Actually, you'll be surprised. Contrary to popular belief, nowadays we see a lot of walk-in patients, for that matter, who would just request for a prostate check. No? So they're completely asymptomatic, and then they would just sit down in their clinic and says, "Doctor, I want to have my prostate check." As simple as that. So no other chief complaints except for a prostate check. So what we do is a good history of their voiding problems, and then we do a digital rectal examination, and usually request for a PSA, or prostate-specific antigen. Surprisingly, there are quite a few patients who would come up with elevated PSA that would eventually lead to a biopsy and a diagnosis of prostate cancer.
Right there and then?
No, of course not right and there, because the result of the test would come out after a few days, and then if the PSA is elevated or the rectal exam is abnormal, then we would recommend a biopsy procedure to detect prostate cancer. So those two tests are the tests, the rectal exam and the PSA are the tests that would eventually lead to the performance of a definitive diagnostic procedure, which is a prostate biopsy. So that is how a prostate cancer is detected.
How about the normal PSA level? We talk about how prostate cancer is detected and the digital rectal exam. What about the PSA levels? What's the normal and what is above normal?
Usually, initially, DRE should be done. It's a physical examination. If there's a nodule or suspicious mass in the rectal examination, that's the time you go with ultrasound and PSA. PSA usually 0 to 4 nanogram per ml would be the normal. Above that would be already suspicious, and we would ask for a biopsy.
Already. Others would opt not to have a biopsy. What do you suggest they do if their PSA level is above normal already?
Actually, PSA is not a confirmatory test of cancer. It's more of a test to estimate the risk of prostate cancer. So as we have mentioned, 0 to 4 is a normal, although there's age-specific range. Younger patients, let's say below 55 years of age, the normal is supposed to be 2.5. So at any rate, let's use 4 as a cutoff. For PSAs between 4 to 10, the risk of cancer in the Philippine population is around 10 to 15%. So we offer that to the patient. Look, you have a 10, your PSA came out, it is 6, so you have a 10 to 15% chance of cancer. Different patients have different perception and different feelings about the risk of prostate cancer. For some, a 10 to 15% chance is nothing. So they would just go on and live a normal life without having to fear about the cancer because they said 10 to 15% is nothing, right? But for other patients, even just a 4.1, with a very small chance of cancer, they want to have their cancer detected and thus would request for a biopsy. Another factor that may change the outlook is the presence of family history. If they have a family history of prostate cancer, then probably we will be a little bit more aggressive in recommending a biopsy. And more so if the patient is of African American origin and Caucasians. They have a higher tendency of developing prostate cancer because in those populations, the cancer is around 30%.
So now that you've mentioned that of ethnic background, there's a difference between who are more prone to prostate cancer, and in Asia, it's a lower percentage.
Also in in family history, if your relative is affected at a younger age, the likelihood would be it would be several folds than the one with whose relative are older who contracted with prostate cancer.
We'll go back to that in a little while, doctors, but we have a Twitter question from username @MamaCough. My dad has Gleason 6 prostate cancer. He already underwent an operation. No medicines were prescribed. He only has a PSA test every 3 months. I just want to be enlightened about his condition. Doctors?
Well, there are a lot of information lacking in this particular question. We need to know the age of the patient. We need to know the pre-surgical PSA level. We need to know what type of surgery was done to the patient. And we need to know the present PSA. So if I'm going to follow the trend of this question, a Gleason 6 usually is a moderately differentiated cancer. So it's not a very aggressive type of cancer. So let's give some presumption. Presuming this is a patient that is relatively young at around 60 years of age, which I would expect because this is a Twitter question, so most of them are younger. So I would expect their parents not to be that old.
Yes.
And then the Gleason 6 is usually a moderately differentiated cancer. Maybe this patient might have underwent a radical prostatectomy, which is supposedly a curative procedure. Okay. That's why no more additional medication was given because the surgery might have already cured the disease. And they do a PSA every 3 months as a form of surveillance to check for recurrence of the cancer. However, if this would be a case of a very an elderly individual, and with a metastatic type of prostate cancer, meaning it has spread beyond the prostate, then the surgical procedure might have been a bilateral orchiectomy or the removal of testicles. No? The testicles is a source of nutrition of the prostate cancer. So if you remove the source by doing an orchiectomy, you're essentially depleting the nutrition of the prostate cells. So in that manner, you are trying to control the cancer. So that is also another form of surgery. So there's a lot of information lacking in that particular question.
Maybe our Twitter follower can give us a call or...
Yeah,
that would be good.
We can answer those questions.
Yes. Thank you, doctors. One more question, this time from Facebook, from Neil. Does frequent sexual activity lead to prostate cancer? Dr. Roque, you mentioned something about multiple partners.
Yeah, going back
Earlier.
to the question, to answer that question, actually, whenever I do lectures, and this question will always come up, frequently asked question, is there any relation between sex and frequency of sex and prostate problem? Because they say they need to be released and all that stuff. But actually, there's a Turkish researcher who really did a study on this, and then he made 2 arms, one from a monastery without sex supposedly, and one in New York. And then they found out that there's no incidence of increased incidence on both sides. So to answer that question, there is no relation.
Okay.
Well, I think I can attest to that because
Dr.
I'm actually part of the University of Santo Tomas, which is a Royal and Pontifical Catholic University, and we haven't seen a lower incidence or a higher incidence of prostate cancer among the priests in that particular institution.
Okay, so no relation. It doesn't necessarily mean if you're sexually active, then you have a higher risk of having prostate cancer. How about having children? Does one who has prostate cancer decrease his risk of having children, assuming that he hasn't had children yet?
Well, I've been in practice for 15 years. I have seen 2 cancers in a 41 and a 42-year-old individual.
Very young.
But most of the time, 40, 41, chances are they already have their family. No? And if they are not married by that time, they probably would choose not to get married at all. No? So, and most of the prostate cancer occurs in the relatively elderly age group. So most of them have already completed their family. So it's not that much a factor in having children or not. However, let's say in the case of a 40-year-old who underwent a radical prostatectomy for prostate cancer, certainly the chance that the patient would be able to conceive a child naturally may be lower, but they can always get to do some form of artificial insemination. Not that I'm promoting it because I'm from a Catholic university, but those things can be performed.
Done.
Yeah.
Okay. We have a question again from Facebook, from Nerissa. This time a woman asks, can women also get prostate cancer? Just as men can have breast cancer. And
Actually,
women,
as mentioned a while ago, prostate is
Just-
solely for men. So probably if you have a husband with prostate cancer, you could have that way.
Oh,
But-
okay. but not necessarily women
yes.
don't.
Yeah.
Okay. Is there surgery that one can undergo to get treated for prostate cancer, doctors?
Go ahead. What?
Yeah. So, well, as far as surgery for treatment of prostate cancer, we have to take it into several contexts. If we are dealing with the localized form of prostate cancer, then the surgical procedure to be performed is a radical prostatectomy. So it can be done either by an open surgical procedure, which has stood the test of time. In fact, even during the early 1990s, even 1900s, no. And recently, robotic prostatectomy, robotic assisted prostatectomy, those are high-tech procedures. Used to be a dream in the Philippine setting, has already been performed, and we have done the first case in year 2010. So all those high-tech modalities are already available in our country, and even the so-called cryoablation that is popularized in the Fuda Hospital in China. In fact, we have already performed cryosurgical ablation
Also
as
in
well.
the Philippines as well.
And even the radiation, the so-called intensity modulated radiation treatment and brachytherapy are all available in our country.
Who are candidates for this kind of
Usually
treatments?
patients who are with the Gleason's, lower Gleason's, a patient who would have an expected life more than 10 years. These are patients that should undergo radical prostatectomy, that's open radical prostatectomy, or other modalities as mentioned by Dr. Letran, like the robotics, laparoscopic.
Doctors, I understand Dr. Roque was also telling me off cam earlier that there is something going on over the weekend before Father's Day.
Yes. The Philippine Urological Association would be having this nationwide digital rectal exam. It's a free consultation that will be manned by fellows of the Philippine Urological Association, 63 medical centers here in the Philippines. We will be having free starter doses from our friends, from our pharma friends, and this will run from 8 o'clock in the morning until 4 o'clock.
So doctors, that's very good. No, that's very nice for all the men out there to take good care of their health. You know, any other last tips since we're talking about good health, Dr. Roque? Any last tips to the men out there?
Okay. We would like to again reiterate that there will be a DRE, and this would be free for all our fellow fathers. Because it's Father's Day. This is our 17th year already, the Philippine Urological Association, for prostate cancer awareness in the country.
Okay. Thank you very much, Dr. Roque. Dr. Letran, last tips?
Prostate cancer is treatable if detected early. So I would encourage people to take advantage of the so-called National DRE Day so that they would be able to detect their disease early and they can be potentially cured of the disease.
Thank you very much, Dr. Roque and Dr. Letran. Again, I'd like to thank our doctors, Aris Roque and Dr. Jason Letran, for educating us all about prostate health. See you again next Tuesday on MedTalk as we talk about baby care. 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.